Welcome to the Sunshine Training Center. For tips, how-tos, and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. In this short video, we'll demonstrate EDC muscle strengthening training, which is most often applied in the management of post-burn intrinsic tightness. This demonstration was prepared by Vita Tu, occupational therapist and project manager at Sunshine Foundation, and by Qingyuan Lin, senior occupational therapist at Sunshine's Taipei Rehabilitation Center. To learn more about what is post-burn intrinsic tightness and the management of this hand deformity, you can check out our online course Rehabilitation of the Burned Hand, Management of Common Hand Deformities. You can also read our blog post Overcoming Post-Burn Intrinsic Tightness, 5 Blind Spots to Avoid, as well as watch our other demonstration video on hook grasp training for intrinsic tightness on our YouTube channel. When confronted with intrinsic tightness, strengthening the FDS, FDP, and EDC muscles can help combat the tightness of the intrinsic muscles and maintain balance between extensor and flexor muscles. We'll focus on the EDC muscle in this video. The insertion of the EDC muscle is in the extensor expansion of the middle and distal phalanges of the second, third, fourth, and fifth fingers. The most important function of EDC is the extension of the metacarpophalangeal joints. When doing EDC training, to avoid wrong movements that will lead to PIP and DIP extension, it is recommended to first use self-adhesive bandage like Coban to fix the PIP and DIP joints in flexion. This can limit PIP and DIP extension and allow the movement to be accurately performed with MP joints in extension. It is better to wrap each finger individually. If 4 fingers are wrapped together, the centripetal force of the bandage will cause finger adduction, which will make it difficult to perform MP extension. Wrapping each finger individually will make it easier to use the EDC muscle to perform extension. First, explain to the patient that the movement is concentrated at the MP joints, and that it's only necessary to extend the joints gently without using too much force. The first step is a resistance exercise. Ask the patient to first perform MP flexion, followed by MP extension against the therapist's fingers, and then relax. Repeat extension, hold for 5 seconds, then relax. Continue as such. The patient may tend to flex his wrist to compensate, so the therapist can gently tap the wrist to remind the patient to keep it relaxed. After completing the resistance exercise, ask the patient to perform active movements. After doing MP extension, pause for 5 seconds and then relax. Repeat this. Because there are many joints in the hand, it is sometimes easy to confuse which joints correspond to which muscle movements. Muscle strengthening movements of EDC and muscle strengthening movements of FDP and FDS are often confused with one another. For example, do you think this strengthens EDC or FDP or FDS? Because this action involves MP extension, it can easily be confused for EDC strengthening exercise. Actually, this movement strengthens FDP and FDS muscles through PIP and DIP flexion. Please be careful not to get confused. Remember, strengthening the EDC muscle can contribute to combating tightness of intrinsic muscles and maintain the balance between extensor and flexor muscles. Maintaining the PIP and DIP joints in flexion with self-adherent bandage can help to accurately maintain the MP joints in extension and effectively focus on EDC muscle during the exercise. Also, not all MP extension postures will enhance EDC, some actually enhance FDP and FDS muscle strength, so the therapist needs to choose the type of exercise carefully to target the right muscles. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation related tips and videos, and visit our website for news about our latest training programs.